As more institutions start to have in-person visits instead of only telemedicine visits, you might be wondering if you should keep doing telemedicine visits or move back to seeing your physician in person. Some people might want to continue doing telemedicine for a number of reasons, including convenience, no travel involved, and limiting your exposure to colds or infections from other patients. There are certain MPN patients that could be seen with telemedicine visits or fewer in-person visits. Listen as Dr. Shammo explains.
So when I think of the patient that might benefit most from seeing their physician via a televisit, for example, it would be someone who perhaps has a stable disease, someone who I may want to monitor perhaps every 3 to 6 months, someone who may have stable counts, and we're just talking about their symptoms and monitoring those types of things every so often. And perhaps I look at the labs and we can discuss their symptoms and whether or not they have splenomegaly and issues like that.
As Dr. Shammo notes, if your MPN is considered stable and you typically only see your doctor every 3 to 6 months, it might be worth continuing telemedicine visits instead of going back to in-person visits.
Someone who may already be on a stable dose of medication and we don't have to do any dose, and even if we had to do dose adjustments, perhaps we could do labs a little more frequently, so that would be all right too.
If you are on a stable dose of your medication and don't need any modifications or just have minor adjustments, you could consider staying with telemedicine visits. But what patients should consider doing more in-person visits now that COVID-19 precautions are lighter? Dr. Shammo goes on to explain that patient could be
someone in whom I would like to initiate a new treatment, someone in whom their disease may be progressing a little too quickly, someone who may want to do an exam and assess their spleen. I suppose you could send them to an ultrasound facility and obtain an MRI or a CT or an ultrasound of their imaging study, that is, of their spleen. But there's nothing like an actual exam of a patient in whom you are thinking about disease progression. So those sorts of patients in which the disease is actually changing its pace, and you may want to take a look at the peripheral smear, look and examine the skin for certain petechiae and signs and symptoms of low platelets and that sort of thing. Look at the mouth for all ulcers and things of that nature.
As always, please discuss with your healthcare team before deciding to switch to only telemedicine visits or going back to in-person visits. They know your history and can help decide what is best for you and your care at this particular time.